In this video, we're going to talk about osteoarthritis and a treatment for osteoarthritis that's been used by many orthopedic surgeons and other healthcare professionals called platelet-rich plasma, or PRP. We'll discuss what PRP is and how it might work. Then we'll dive into the current research on the effectiveness of PRP for arthritis of the hip and knee. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Please understand, in this video, I'm not giving you medical advice. This is meant for general information and educational purposes only. Now, osteoarthritis is the most common form of arthritis there is. It affects more than 30 million adults in the US, approximately 23% of the adult population. It's the second most expensive condition treated in US hospitals. It accounts for more than $16.5 billion in hospital costs every year. Now, it's become really clear in the recent years that osteoarthritis is the result of a long chain of events, not just the wear and tear of the joint, despite most orthopedic surgeons telling patients it's simply wearing out of the bone and cartilage in your hip and knees from injury or repetitive stress on the joint, like running 3 or 6 miles per day or doing a physically demanding job. While loss and breakdown of articular cartilage is the endpoint of the disease process, the actual disease involves an imbalance of the inflammatory mediators of the joint, resulting in cartilage degeneration, degeneration of the extracellular matrix, systemic inflammation throughout the body, chondrocyte cell death, and osteophyte or bone spur formation and bone remodeling. Now, as of today, there are no treatments that definitively cure osteoarthritis. Treatment by most orthopedic surgeons and doctors focuses on patients getting rid of their symptoms and treatments to try to decrease symptoms. They focus on trying to modify patient activities, relieve pain and stiffness, improve joint function, improving quality of life, and delay or avoid the need for joint replacements. Now, the non-surgical treatments that most orthopedic surgeons use today include non-steroidal anti-inflammatory drugs like ibuprofen, weight loss, dietary supplements like glucosamine and chondroitin, topical agents and topical anti-inflammatory medications, intra-articular injections of corticosteroids, cortisone shots into the knee, or hyaluronic acid. Let's quickly talk about cortisone shots and their pros and cons. A recent Cochrane review concluded that corticosteroids provide a small benefit compared to placebo 4 to 6 weeks after the injection, a small effect 13 weeks after injection, and no difference 26 weeks after the injection, 6 months. That's why you hear people who've had a cortisone shot say that it wore off and they needed another one and another one and another one. But also understand that post-injection flare-ups can occur in about 25% of patients receiving cortisone shots, and that can last for several days. Sometimes people have skin depigmentation or skin or fat necrosis at the injection site. And more importantly, there's evidence that the increased use of cortisone shots can actually lead to cartilage breakdown. A recent randomized clinical trial compared corticosteroid injections or cortisone shots to saline injections with knee arthritis. The authors found that the cortisone shots resulted in greater cartilage volume loss seen on MRI compared to saline, and there was no significant difference in knee pain severity between the patients who received a cortisone shot and those who had gotten a placebo injection. Now let's turn our attention to platelet-rich plasma. What is platelet-rich plasma? Well, PRP, or platelet-rich plasma, is being used really by orthopedic surgeons across the world for a number of different injuries and orthopedic conditions due to the healing potential contained within the platelets. It's an autologous blood product. You basically take a small amount of a patient's whole blood through just a regular blood draw. Then you concentrate that blood sample using a centrifuge. Then you re-inject the concentrated plasma back into the patient, into the knee or whatever joint. That concentrated plasma has a high concentration of platelets, usually about 2 times or more greater than what's in your whole blood. Well, why might that work in osteoarthritis? Well, in the lab at least, PRP seems like it would be very helpful to patients dealing with osteoarthritis. The platelets have alpha granules that are basically a reservoir for growth factors and cytokines and many other proteins. The dense granules of the platelets store ATP, ADP, calcium, histamine, serotonin, and dopamine. PRP is thought to improve the environment within the joint more than creating a long-lasting regenerative effect. Research in the lab shows that PRP can alter the imbalance between pro-inflammatory cytokines and anti-inflammatory cytokines that lead to those inflammatory pathways, and that might be a key way that PRP affects disease progression. In addition to down-regulating the joint inflammation, PRP can positively influence chondrocyte apoptosis or cartilage cell death. PRP might not lead to hyaline cartilage regeneration, but it might still offer a clinical benefit with symptomatic and functional improvement, and it might slow down the degenerative processes. When the platelets are activated, the growth factors in those granules respond in a localized manner, and it happens quickly. Almost 70% of the growth factors contained within the alpha granules, they're secreted within 10 minutes. And these growth factors, along with coagulation factors and cytokines and chemokines and other proteins stored within the platelets, have been shown to stimulate chondrocyte and chondrogenic stem cell proliferation. They promote chondrocyte cartilaginous matrix secretion, and they diminish the breakdown that comes from the pro-inflammatory cytokines. It also appears to increase production of type 2 collagen, which stimulates hyaluronic acid production and assists with stem cell survival and proliferation. Now, that's a lot of fancy basic science. Let's look at the current or recent studies about how PRP is done for osteoarthritis. There was a 2021 meta-analysis of 30 randomized controlled trials looking at different intra-articular injection for knee arthritis. Intra-articular PRP had the best overall outcome compared to cortisone shots, hyaluronic acid, and placebo at 3, 6, and 12-month follow-up among osteoarthritis patients. A 2021 meta-analysis of 26 randomized controlled studies looking at PRP versus hyaluronic acid for osteoarthritis had over 2,400 patients. And all the different outcome measures, pain scores, physical function scores, and so many else, it was better for PRP than hyaluronic acid at 3, 6, and 12 months. They were also, some of the functional scores, significantly better for PRP than hyaluronic acid at 6 and 12 months. No difference in terms of adverse events with the two types of injections. So they concluded for non-surgical treatment of knee osteoarthritis, injecting PRP into the knee significantly reduces patients' early pain and it improves function much more effectively than hyaluronic acid does for patients with knee osteoarthritis. And again, they're both equally safe. A 2020 meta-analysis of 34 randomized control studies, including over 1,400 knees in the PRP groups and over 1,400 in the control groups, basically showed very similar results. The PRP provided better results than other types of injections, and the benefits increased over time, especially once you got to 6 and 12 months. Now you could say, well, it just may be the placebo effect, and that makes sense. There are important placebo effects that have been observed pretty much in every knee injection study, and especially in biological trials, because patients think that they're getting a regenerative medicine. But while placebo might play a role in some of these PRP results, when you look at PRP versus a placebo injection, PRP greatly exceeded those in terms of benefits. Now, another question, how much PRP should be injected into your knee? Well, the different commercially available PRP kits usually focus on taking as little blood as possible, 20 to 30 milliliters, and the final product is usually somewhere 3 to 4 milliliters. Now, some experts believe, and I agree with this idea, for osteoarthritis, you want to get about 8 milliliters of PRP. The goal is to ensure that you have the platelets and plasma in the final PRP product that can get all throughout the joint. When that PRP is activated, the plasma forms a clot which traps the platelets and it creates a scaffold. The PRP, the greater the volume of PRP, just the greater number of platelets, the greater the scaffold, the more growth factors you have. But to get 8 milliliters of blood, you typically need more than one kit when you're getting it from most commercially available kits. So that's one thing to ask about when you're talking to your doctor about this. Now, it is very important you understand the research with PRP is all over the place. There's different methods of preparation, there's different final products, PRP, leukocyte-rich PRP, platelet-rich fibrin, platelet gel, and so many more. All of these platelet products have varying concentrations of plasma, blood cells, fibrinogen. They have different growth factors, different concentrations of bioactive molecules, so they could have very different efficacy for hip and knee osteoarthritis. And the exact composition of PRP is not even reported in many of the studies. Again, there's leukocyte-rich or white blood cell-rich PRP, leukocyte-poor PRP, and so much more. Plus, humans have different numbers of platelets in our blood, so studies comparing PRP can give very different results. And the research studies also differ in things like the amount of blood harvested, the amount of PRP generated, the number of times it's centrifuged, the number of platelets, whether the platelets are activated, and so much more. All of those factors could influence the final PRP product and how well it helps in patients with osteoarthritis. And people ask very frequently, is it covered by insurance? Well, most insurance companies still consider PRP experimental and will not cover these treatments. And again, I'm not giving you medical advice. This is meant for general information and educational purposes only. So what can we conclude from all this? Well, based on these studies, platelet-rich plasma appears to offer a significant benefit, maybe not so much in the early follow-ups, 1 to 2 months, but especially over time, 3 months, 6 months, 12 months, compared to placebo, compared to hyaluronic acid, and even compared to cortisone shots. When you look at scores of function, pain, and other osteoarthritis symptoms, there's a common trend. There might not be a difference between PRP and cortisone shots or hyaluronic acid in the first few months after injection, but the benefits become noticeable starting at 6 months, leading up to 12 months and beyond. Now, it could be that PRP doesn't offer better results as much as it offers longer lasting results compared to corticosteroids or cortisone shots and hyaluronic acid. The differences between PRP and other injections become apparent over time, much more so as the hyaluronic acid or the cortisone shots wear off. And while it's substantial, the improvement in patients who undergo PRP injections is still what we call partial improvement. It doesn't make the problem go away forever. We still need more research to confirm long-term benefits and really figure out the best formulation and indication for these PRP injections for hip and knee osteoarthritis. Now, if you want to read the studies I mentioned in this video, I've put links in the description below. If you like videos like this one and you want more information about optimal health and wellness, healing and recovery from orthopedic injuries, whatever they are, sports, exercise, it doesn't matter, so that you can feel and perform your best regardless of age, injury, or medical history, subscribe to this channel, click the bell to be notified when I release a new video or when I start a new live stream. If you have hip or knee arthritis and you want to see somebody who truly knows about bone and joint injuries in athletes and active people, I'd be happy to help. I'm a double board certified orthopedic surgeon and sports medicine specialist. I'd love to talk to you about all your options to recover from injury, not just surgery, cortisone shots, and physical therapy. Go to my website, drdavidgeier.com, go to the contact page to request an appointment to see me. The link to my website and the contact information is in the description below. My name's Dr. David Geier. Thank you so much for watching. I look forward to helping you feel and perform better than ever.